everyone, it's Alicia, and today I'm here with Dr. Bilski of Bilski Dental Group. How are you doing today?
I'm feeling great.
Good. So in this week's video, we are going to be talking about how you guys keep your office sterilized and clean for your patients. Yeah. So that's at the forefront right now, and I just want you to kind of walk us through that.
You know, during the times of COVID pandemic, that is on everyone's mind. Clean, sanitary is another word, and safe.
Yeah.
In our practice, we've been doing this for many years, so it's nothing new for us. Yeah. Some may be afraid to come into the dental practice thinking all the people's germs and opening the mouth and spit all over the place.
Probably one of the scariest places if they really think about it, like, oh, I don't want to go there.
Exactly. So, you know, grocery stores and gas stations should be the scariest places, or maybe even the ATM machines. So
but that's not what people think always.
Exactly.
So this is why we're here today to just walk
it's
through.
not a big deal to go out to the grocery and pick something up, forget your mask, and maybe not wash your hands. So we've been doing this for years. I've been practicing 33 years. Things, of course, have changed over that time, but you'll see in the next few images here. We were actually even identifying our areas within our practice so patients know what's going on back there, and it's not mandated by law to do that, but we've been doing this with a simple sign like, hey, you're not personnel that should be in there. This is a sterilization room. Keep your hands to yourself, and we'll just let you look at it. So if you show the next picture here, the two large stacked units that look like microwaves or potentially look like microwaves are steam autoclaves.
Okay.
Under heat and pressure, any instrumentation that comes from those two machines are sterile. They're in packs, they're covered, they're not touched. I mean, even I think Domino's or Pizza Hut is saying, hey, you can have a pizza without being touched.
Yeah.
So contactless.
Right.
The smaller unit that's on the bottom there with the green handle is a Statum. It's a quick flash sterilization. So that is packaged, and we can get things in and out real quick if we need them in a pinch. And then everywhere around that is the sterilization. So there's a workflow. It starts from the left and goes to the right. You never go from the right to the left. There's a green arrow that says this is the entrance, and the red means don't go in that entrance. That's the way out. So, and then on our staff, this is Wendy. She is our hygienist, and Wendy and I have been working together for 33 years. Wendy has always worn that cover up. Okay. Wendy has always worn gloves, and the mask certainly she's always worn, and the goggles underneath that big face shield. So the only thing that's really new is the face shield, but we've always had them. Yeah. And we primarily use them when we have aerosol appointments. So that means anything that's spraying water and potentially blood. Yeah. That's what we do. But that's the new norm, the term is. Yeah. But we've been doing that for many years. So I just want our patients to know, or anyone that's seeing this video, that there's nothing that's really changed in our practice that anybody should be worried about. But we do understand that people are concerned about it. So this is more informational. I don't want to go into the details of COVID, and you can get that on any news station.
We've all heard about it. We know, and this is the most important thing now, just making sure people feel safe and comfortable.
So when you come into our office, you call. We come to the door, we unlock the door, we take your temperature, your digital temperature. We ask a couple quick questions. Have you been out of the country? Everything's okay. And as long as you are under 100.3, we allow you to enter. Yeah. If you're over that, we wait, take your temperature again, and then we kindly request that you see your physician. And then that's just the standard. And then you leave, everything's wiped down. We don't have anybody passing in the hallways. And then we try to minimize the amount of contact that we are going to physically or verbally have with any patient, and also reduce the contact by 50%, 50. Wow. So that's considerable. So there is a little bit of a delay because we have to wait for someone to clear the hallway so that we can let you come in or let you go.
Yeah, wonderful. Well, you know, most of those things have already been in place, as you said, but you are taking and adding in some extra policies, things people are going to be seeing no matter where they go. We're seeing them everywhere. You go to the grocery store and you see a lot of those things.
I think the awareness is really what we're trying to get to. We've also added air purification.
Oh, wow.
And we're bringing in high evacuation aerosol removal. Wow. So when I have to drill and you see all that water spray, we have a suction unit that takes about 97% of it away.
Wow.
Which is a huge reduction, to
absolutely.
say the least.
All right, wonderful. Well, if you have been worried about going into the dentist just because of those different things, the world is changing right now, and we're not always feeling comfortable. I think based on this conversation, I would feel 100% comfortable coming into your office right now, and I wouldn't have to worry about getting sick or...
because you said that, our office is a scary place, and I think in any of the procedures that we talk about in these past blogs that we've done, the comfort level that we've seen from our patients, they actually review our site, and they say things like, "Oh, we saw Wendy today, and I felt so much better after I came in. I was so nervous that we were going to be opened up, and Dr. Bilski and staff and Dr. Timmerman weren't going to be prepared for it." Yeah. We had been preparing our entire careers, so it wasn't anything really that was new to us or for us. And it's just nice to get positive feedback without the anxiety level that most people just have to show up anyway. Now you add a pandemic. Yeah. Crazy.
Wonderful. Well, I mean, like I said, it sounds good to me, and I'm sure that after watching this video, a lot of your patients are going to feel a lot better. Maybe people who have never come to your office before will see this and be like, that's what I need. That's the place to go, just because you have it all lined out and you're very transparent about it.
We try to be, there is nothing hidden. You need to know about your safety. You need to know about your own health. And oh, by the way, I have to protect a staff of 13 people in our practice too. So a lot of those measures are taken to protect me and my staff, and then vice versa. So it's a little bit of a synergy going on here.
Wonderful. All right. Well, if you are looking to come into Dr. Bilski's office, or maybe you're a current patient and you just haven't been in for a while and you haven't been so sure, this video should give you that clarity, that peace of mind that when you go to the office, you're going to be safe. And if you'd like to get in contact to schedule an appointment, you can give them a call or visit online at bilskidental.com. Thanks again.
Thank you.